Welcome to the Cambridge Health Alliance Health is Wealth. My name is Roberta Robinson. I'm Director of Marketing and Outreach for the Geriatric Division of the Cambridge Health Alliance. And today we're going to talk about a subject that can be confusing to some people. We'll probably make it a little more confusing today with the information, but maybe we'll simplify things. And our guest today is Lucilia Prates.
You did a good job.
Did I? Thank you. And she is from the Massachusetts Senior Medicare Patrol. So tell us what that is. Welcome, first of all.
Thank you.
And thank you for being here and talking about this very important subject.
So the Massachusetts Senior Medicare Patrol Program is a program that's funded by the Department of Health and Human Services. To be more specific, the Administration for Community Living, which used to be known as the Administration on Aging. And I say all that because we need to acknowledge our funders, right?
Oh, always.
So, and it's our tax dollars at work, really trying to educate Medicare and Medicaid beneficiaries, their family members, caregivers.
And that is an ongoing process, isn't it? Because it's always changing, and that doesn't help us.
Yes.
It doesn't help you.
I say to people all the time, our healthcare system is a shifting terrain. It's shifting as we speak, and so we really need to just be very engaged and very informed, ask a lot of questions, and no question is a silly question. We've always heard this, but I really, really believe this more now than ever before, because there are so many intricacies and so many complexities within the healthcare delivery system and Medicare and Medicaid and other health insurance policies, and it's a puzzle, and it all works. You know,
that's why they have us.
Yes.
We navigate you through.
We help people navigate, yes.
Right.
So the Senior Medicare Patrol Program goes out on a daily basis, and what we do is we educate, we do a lot of outreach, we do a lot of education, a lot of counseling of individuals and their family members, their health advocates, and professionals.
So do you go out to like individuals, or do you go out to do presentations?
So we do presentations in churches, we do presentations for alliance clubs, we do presentations for the councils on aging, for different ethnic communities, and we were able to deliver our presentation in multiple languages. And what we do is we really educate people about what to expect from Medicare and Medicaid, who to call when they have complex issues to resolve. And I'll give you some examples of some issues as we go forward. And, you know, really to be very informed, encourage people to be very informed. You know, around open enrollment, for example, we throw around that term, open enrollment. But to know that every October, you really should be seeing a SHINE counselor. And figuring out.
Let's explain what a SHINE counselor is for those who might not know.
SHINE is serving health information needs of everyone. And what SHINE does, it's run out of the Executive Office of Elder Affairs. And what it does is it educates individuals or helps people navigate their insurances. So if you're Medicare or Medicaid eligible, you can see a SHINE counselor, and they will help you understand if you need other insurances, what kind of Medigap plan do you need? Are you better off with the Medicare Advantage plan? So they give you a wealth of information, and then you make your decision as to what better suits your needs.
Right. So what I found for some of our people is a lot of people aren't aware if they're a Medicaid eligible. They're not aware of it. And, you know, as we know, there are 3 waiver programs in Massachusetts which would allow people to be over the community cap, but they need some assist with things. And so, but a lot of people don't know that. So there are programs that exist.
Yeah, and just ask those questions
and
go to the organizations that have the knowledge.
Right.
You know, and don't settle for the first answer. I always say to people, be persistent. If you feel like you're eligible for something, check with another person. You know, keep checking.
Not with your neighbor, though. Check with the professionals.
With professionals and people who know this stuff. And make sure the person you're speaking with is a seasoned individual. You know, who has been doing this for a while.
Like me, I'm seasoned.
I'm getting there. understands, you know, who just didn't get started on doing this.
Right.
And that's not to knock anybody who's getting started. We applaud that. We want people to be involved. If you want to be a volunteer with Shine or with the Senior Medicare Patrol program, we welcome, we train, but it takes a while to catch on. I say to my staff all the time, and volunteers, I say, I don't have all the answers. Oftentimes I go to do a presentation and I have to say to them, I get stumped. And I'd say, I don't know that, but I will check into it.
Right.
And it's a learning opportunity for me. So, so that's, keep
So
going,
do you go
keep
out
asking.
to would you go out to housing buildings as well?
So we go to, yes, we do
Yes.
a lot of work with resident service coordinators. We
Yes.
go to elderly housing.
Yeah.
We go to, again, I already said this, I'm repeating myself, but we do a lot of work with the COAs. We do a lot of work with, we put on a conference every other year, a statewide
Does that
conference.
rotate?
Yes, it does rotate.
Yeah.
We, because we are a statewide program.
Right.
So, and we're only a staff of 3. It's myself and Caroline, who you know,
Right.
who's, does a yeoman's job at recruiting volunteers and training them and getting them, she's a cheerleader as well, just moving people along and getting our work done. And we have David on our staff as well, who does a lot of case management work with me and our case managers, who are primarily volunteers, who are really invested in this and really believe in the mission of the program. Because the mission is, again, to reach and educate and counsel individuals so that they are protected against healthcare errors, fraud, and abuse. There are $60 to $90 billion wasted, okay, in fraud, okay,
I believe that.
annually. And a couple of years ago, we had the director for the Centers for Program Integrity from the Centers for Medicare and Medicaid Services as a keynote speaker at our conference, statewide conference, and he spoke about the fact that if you put fraud, errors, abuse, overusage together, that 60 to 90 billion dollars mushrooms to over 250 billion annually.
That's incredible.
That's incredible, and that's why our healthcare costs are what they are today. And so we really need to be very watchful. So when we go out and do these presentations, I'm going to take this opportunity to toot our little personal healthcare
Yes,
journal.
we can do show and tell.
Okay, great. So we encourage people to use a personal healthcare journal. Now this is the Senior Medicare Patrol programs, and people can call us and we will gladly send this out to them. We give them out at all the presentations. This is really a toolkit. It's a brochure and the journal that allows people to put in their meds, their doctor's names, their care plans, their immunization records, a lot of very important information. And we give them a pen.
Carry that with them?
They can carry it with them, or they can, take it with them when they go to the doctors, when they go away,
Yeah.
just in case
Yeah,
they
very important.
need it,
Right.
It's very important to have this information accessible. But I say to people all the time, if you don't like this little journal, you don't have to use this. But everyone should really be keeping a chronological account of what happens to them in the healthcare system.
Right. And that medication list
Is
needs
really-
to be updated every time a medication is changed.
Yeah.
And we know how often that happens.
Yes.
Often. It happens often.
Very often.
Yeah, and people forget to do that.
Right, and so people are now feeling very reliant on the fact that, well, my doctor gives me a medication list. Well, you know what? That medication list oftentimes that you get when you visit your doctor is not accurate any longer because there have been alterations made to that list. New prescriptions that have been discontinued. So people really need to be very cognizant of that. And also to convey to their doctors that, I take these meds, but I also take vitamin A, vitamin B, vitamin
That's
this,
very
vitamin that.
important.
Really important to be very transparent with your physician.
Because the herbals can also affect medication. So it is important that you get all of that information.
All of that information needs to be out there. And then we encourage people to really read their Medicare summary notices. The notices they get every 4 months from
You mean this is
every
not
3
a
months.
bill?
This is not a bill. That's actually a Medicare summary notice. And that's informing people what Medicare was billed, what Medicare allows, what Medicare paid, and then what was sent to your Part B plan. okay, which is the Medigap, the Medigap plan. Scratch what I said, Part B.
Right.
The Medigap plan. And
which is your supplement.
which is the supplement, which pays Medicare only pays 80%. It was only intended to pay 80%.
Right.
So the supplement will pay the other 20.
Right.
And that Medicare statement that people get really spells things out for them. I know they're a little bit iffy to read, and you feel like you need a PhD in MS in reading. But once you've read one or two or three of them, you really get it.
Yeah.
And we ask people to call us. If you have questions, call the Massachusetts Senior Medicare Patrol Program. I don't know if you're going to announce our number.
Yeah, go ahead.
Okay, it's 800-892-0890. And call us anytime, and if we typically answer the phone, but if we don't, leave a message. We promise to get back to you. And we will help you navigate this.
I just want to, if I may, I just want to point out that you either have traditional Medicare, which is Medicare A, which is hospitalization, B, which is doctor visits, D, which is prescription drugs, and then a supplement. You'll need a supplement. If you don't have a supplement, and you go into the hospital, 20% of a big hospital bill could
Could be
devastate
yours.
you, could
Yeah.
devastate you financially. So you need that extra gap insurance. Or, if you don't have that, then you have what Lucilia talked about, a Medicare C, an Advantage plan, which is a wraparound, all-inclusive.
Yeah.
So know that those are the distinctions out here, because
Yeah.
that is important as well.
Yeah, and that's confusing. So,
It is very confusing.
people don't necessarily know the ABCDs of Medicare,
Right.
and you don't have to, but, please feel free to call and ask.
Right, you at least
Because-
know now that they exist,
Yes.
and
they
that's an
exist.
important thing.
And people just need to be very aware of what they're getting billed for. So I'll give you some examples of some cases, because I think this really drives it home for people. I actually just came out of a case management meeting with my case managers, and we have been working on cases where an individual was called about back braces, and I think there might be somebody out there in the audience listening to us that, and viewing the program, that can relate to this. You get a call, you have back pain. Well, who doesn't after shoveling all these storms and yet want to come, right? So the person was sent a bunch of braces that she didn't even know what to do with, okay? To the tune of Medicare being billed in excess of $5,000. Medicare paid $2,000 and some odd, $2,000, I'm gonna say $500, round it off, okay? And Blue Cross Blue Shield, the Medigap plan, paid $555.97. And I remember that number vividly because we were just discussing it this afternoon before I got here. And make a long story short, we got involved, and Medicare retracted payment for the 2,000 and some odd, and it was 2,800 and something, if my recollection doesn't fail me. And now we're working with Blue Cross Blue Shield, so Blue Cross Blue Shield can get their $555.97 back. Okay, so that's one example. Another
And
example.
meanwhile, does this woman get a brace?
This woman did not need a brace.
She didn't even need a
She
brace.
told them she did not want a brace,
Oh,
and they went ahead and sent it to her. And it was very deceptive in the way they did it, because they had to send a certification to the doctor to get signed off. So, but people have ways around how to get around the prerequisites of getting these things certified and
Right.
approved. They're
Right.
they're
Is
very
that
savvy.
on particular companies' bad reputations?
Well, what happens is we put all of our data into a national database called SIRS, Smart Fax Information Referral Services, and every February, the end of February, the Office for the Inspector General lifts a report of all of the monies that we've been able to recoup. And where did this happen? So they're looking at trends, obviously, of, ABCD company, XYZ hospital, LMN doctor or doctor services. So somebody is looking. somebody's watching.
Good,
Okay?
good.
So, we see a lot of concern around durable medical equipment, and I don't need to demonize any particular sector, but we see this, and the issue,
Can we explain?
durable medical equipment is when you get a walker, when you get a wheelchair. So this is particularly important. For example, if you get a wheelchair, and you've been, your doctor certified that you need a wheelchair, Medicare pays for the wheelchair, and then you really didn't get it. It was under your Medicare number, okay? So, for example, I'm getting a wheelchair, but it's under your number,
Oh,
okay? And that happens often, these errors. And so when you need a wheelchair within the next
Okay.
5 years, you can't get it
Right.
paid for.
Right.
You have to pay for it yourself.
oh,
So this is problematic. And it's very problematic. So people really need to be very cognizant of the services that they're getting, okay?
and needing.
And needing, yes, and needing, because if you don't need something, then you shouldn't be getting it, you know?
Because it might get in your way down the line when you
Yes,
really do need
Yeah,
something.
you really might.
Yeah.
And if you need a wheelchair for a temporary period of time, you can typically get those borrowed from councils on aging too. And there's plenty of durable medical equipment out there, even to be donated. So people
I know
should,
the Masons.
yeah, they do a great job,
Yeah,
great
and
job.
Malden, that I know of, they have a holding site for
Yeah,
a lot
for
of
them.
equipment.
Yeah.
Mhm.
Also, holding these things is, these wheelchairs and beds and things, it takes up a lot of room. So a lot of places can't really do that,
Store
but
them, right.
store them. But I encourage people to really do their homework, ask a lot of questions. The Massachusetts Senior Medicare Patrol Program, I pride myself in saying that what we do is we advocate for the consumer, and we want consumers to get what they're eligible for, and we will hold your hand until we resolve an issue. I pride myself in that, and so do the people that are so committed to the work that we do day in and day out. And we're there to help people navigate.
Well, that's wonderful. We need all the help we can get out here.
We do. I want that help to be there for me someday.
That's right, that's
Yes.
right. Hopefully we won't need it.
Oh, no.
That's my plan. But I just wanted to mention one thing when we were talking about maybe going to the Masons or getting some equipment. If you need something, it should be prescribed by your doctor, your physical therapist, and it should be maintained for you by the people that know you as well.
Yes.
I just want to be clear about that, because I have run into a lot of people that are using walkers that were someone else's walker or their wheelchair or whatever, because someone else had it and they used it, but it doesn't mean that the height is right for them.
Right. You need to get that. You need to get
Right.
that really squared away with the PT person. then.
Exactly.
It's
So I
very,
just
very
wanted to
important.
point that out.
Yeah. No. I see that all the time. People
Right.
walking with a walker that it's for somebody that is.
Well, my neighbor gave me this.
Yeah. Be
Right.
careful of that. Yeah.
Yeah.
Be careful of that. Another thing that should be said is that whatever health plan your neighbor has isn't necessarily the appropriate one for you, or even your spouse.
That's true.
Because you could
be
have
on two different.
you could have a spouse or a significant other who has no health issues or a lot of health issues, and the plan that I have may not be appropriate for him
Right.
or her.
Right. The
You know.
beauty is there are some, you can do it individually.
Yes, and it should be done individually.
Right.
Now, one very important thing that I want to mention is the new Medicare cards.
Yes, let's talk about that, because that is an important thing.
Yeah. So there are so people asked for this and they got it. They wanted Medicare to remove Social Security numbers from Medicare cards. And so Medicare listened, and people are getting new Medicare cards, all 58 million beneficiaries. Medicare beneficiaries will be getting new Medicare cards. They are rolling out this effort on April of 2018, and it should be concluded by the end of April 2019.
So, and this, they assign a number, is that what?
So
happens?
it'll be a randomly assigned number, okay,
So
by a
it will not be
computer.
a social
It
security.
will not be a social security number.
Mm.
It'll be a uniquely, okay, randomly given number through by a computer.
Right, and so in our old cards that we have,
In our old cards that we have, there will be instructions on what to do with them, and that is to shred them, get rid of them, because you don't want anybody getting a hold of your Medicare card.
right,
Because your current Medicare card is your social security number,
exactly.
or your spouse's,
Right,
right?
right,
Or a parent, if a child is getting Medicare through a parent. But anyways, the important thing is that people get rid of that card or put it in a safety box, okay? But be very careful that the wrong person doesn't get their hands on it, because that is your social security card. And you can wreak a lot of havoc in one's life by having their identity stolen. So people need to be really cognizant and careful of that. Very, very important. There will be no changes to people's benefits. That's a very important thing to remember and to know.
so the only thing it changes is the number.
Is the number, the card, is gonna look slightly different,
Oh,
okay?
no red,
It's
white,
not-
and blue?
Well, it'll be red, white, and blue, but it'll be a little bit of a different design,
Okay,
okay? It'll still be paper, because people are asking me, is it plastic? Is it like a credit card? It's still paper, just like the other one. Okay, beware of anyone who calls you and says, we are calling you for Medicare or Social Security, the new cards are coming out. If you pay $50, we'll expedite this. If you want your card, forget it, hang up. If somebody calls you and they allege to be from Medicare and Medicaid, I say to people, hang up. And Medicare doesn't really call,
no,
okay? Medicare wants you, like the IRS, or Social Security wants you, they're gonna write you a letter. Please do not entertain these individuals who call you. Don't engage. The only thing that people need to do is to make sure that Social Security, in fact, has your right address, your correct address. And if they don't have your correct address, if you have any questions about that, you can call Social Security at 1-800-772-1213, or you can visit ssa.gov /myaccount ssa.gov/my-Medicare. I gave you the wrong number again. My account. Is there some way we can put this up for people?
not now, that would
Okay.
have to go up ahead of time.
Call the Massachusetts Senior Medicare Patrol Program if you want information,
Want to
and
give
we will
that
give
number
it to you.
again?
The number is 1-800-892-0890, and we will gladly guide you and answer your questions. If you're a TTY user, you should be calling 1-800-325-0778. And that's my vision going. Sorry. So, in a nutshell, that's the Medicare card. Social Security numbers are coming off them. People are to shred that card or put it in a very secure place, and
not to carry it with you.
Don't carry it with you. You don't need to carry your Medicare card with you, because if people say to me, "What if I get into an accident?" If you get into an accident, we have what's called the Hill-Burton Act. You will be seen, you will be taken care of at the hospital. And then you can follow up with all of the information that you need to get to them. Do not worry about that. Try to keep your information secure. We're seeing more and more fraud happening to people, and it's scary.
Yeah, it is
It's scary.
Mm.
It's very scary.
So we have about 3 more minutes. Do we have any topic to cover that we haven't covered?
No, but I would love to encourage people who are listening to call us. If you want to become a volunteer with the Senior Medicare Patrol Program, we'd love to have you. We train people. We do trainings
Where
on a
would they
regular
have
basis.
to go?
It could be local.
Oh,
okay? Because we are a statewide program, so we need people all over.
so they could do
So-
it in their own community?
Yeah, this is Cambridge, right? This
Right.
program only airs in Cambridge?
Well, no, we're on YouTube, actually.
Wow.
We're on YouTube, and we're at 9 local stations.
Okay, so the 9 local stations, 9 local communities, right? If individuals are so inclined to volunteer with the Senior Medicare Patrol Program, we would love to hear from you. Give us a call, we'll send you an application. We offer training, ongoing training. There's lots of wonderful opportunities. Some of even to travel a little bit.
Oh.
We actually have one of our volunteers who's going to be on Martha's Vineyard this weekend,
Well,
doing an event for us.
hopefully after the storm, that's good.
It will be after the storm, and unfortunately, it's not a little bit nicer out there, right?
Yeah.
It would be nice if it was.
Right.
So,
It will happen.
it will happen. It will happen. So there's a lot of interesting opportunities out there for people. We encourage you to call us. If you, if your church or or community group that you belong to would like to get a complete and comprehensive overview, 2 hours, okay? Overview, at least 1 to 2 hours. When I come out, it's 2 hours.
Okay.
Overview of, what to protect yourself against. We encourage you to please call us. We will come out and do a full-blown presentation for you. Observation status is something we probably should have spoken about. If people go into the
right.
hospital, we can do another show maybe.